Hello, everybody. We'd like to welcome you to the month of October. It's going to be a lot of fun. We're going to be talking about one of our favorite subjects, and that happens to be female hormones. I'm Dr. Bob DeMaria, and I'm joined by Dr. Kaysen DeMaria, and we're going to be taking your questions. We have a very special giveaways tonight. We just have so much to talk about. I know that there are ladies watching us from all over the world, and I want to thank you for participating with us. So we're going to get right into it. Before we get started, I want you to know that if you have any questions, you can type them. They will be sent to me, and I'll answer any questions. By 9:20, we have to have all the questions sent in so we can make sure that we have all of them. We're just going to have some conversation. So I'm going to turn it over to Dr. Kaysen because we've had a lot of topics sent to us this month. So Dr. Kaysen, where would you like to start with?
Well, I think most of the questions this month have been regarding the thyroid gland and what women can do to help prevent increased estrogen in their body, and also how they can supplement and take care of themselves naturally to help support the thyroid gland. So first of all, talking about the thyroid gland, your thyroid gland is very important, which helps support your breast tissue, your ovaries, and your uterus. And a lot of different things can antagonize the thyroid gland. And Dr. Bob, if you wanted to talk about a few items that we see commonly in our practice that can really antagonize your thyroid function.
You know, it's kind of interesting that Dr. Kaysen brings it up, because a friend of mine, Dr. David Fram, who has written at least 10 books, and one of them is called The Answer to Cancer and the Cancer Battle Plan. And in the book, he was just talking about, if you can find the pattern that causes the problem and reverse the pattern, you can reverse the problem. And what Dr. David found is one of the leading causes of breast cancer happens to be subpar thyroid function. And as silly as this might sound, I'm sure that most of you watching me took a shower the last 24 to 48 hours and you were breathing in chlorine gas. And Dr. Kaysen and I know that bromine, fluorine, and chlorine are antagonistic to the thyroid gland. That's one of the reasons I know I have a shower dechlorinator, and I know that you guys use a shower dechlorinator in your home. So if you have cold hands and cold feet, and if you have wide spaced teeth, if you don't have a bowel movement every day, because Dr. Kaysen and I, we're with new practice members every day, and we ask a lot of those questions.
And some of the things that we ask, especially women coming into the practice, is do you have tender breasts during your menses? Do you have a heavy menses? And I know, like you were saying, Dr. Bob, cold hands or cold feet, constipation, varicose veins or spider veins. Hemorrhoids are a common body signal also of whether it's liver or could be also thyroid and other things going on as far as hormonally in the body. And I think especially being a woman chiropractor in our practice, I see a lot of women that have been around the racetracks, and they've done a lot of different things as far as alternatives or even other things that they're doing that they might not be down the right path. So I think tonight what our job is, we're going to tell you some nuggets that you can start doing tonight and start investigating to make wiser decisions about balancing your hormones naturally.
And I think the real issue that we have that we're dealing with, whether it be men or women watching this right now, is that estrogen is the issue, and estrogen is everywhere. We live in a sea of estrogen. And our goal is, what can we do to help you minimize the estrogen in your body? And Dr. Kaysen just mentioned something that was so important. It is the liver, the compromised liver. So if you do have varicose veins or spider veins or hemorrhoids or the ever-feared cherry hemangiomas, which are the little red bumps on your body, we know when somebody comes in, that's a body signal of liver. And I know another common question that we ask individuals is how many babies that they've had. And if they've had 2 babies, what do we usually see?
We see commonly they have a congested liver, and especially after baby number 2, working on processing and getting rid of all of those toxins, but also your body has to recuperate post baby number 1 and then baby number 2. So we encourage our members after baby number 2 to start working on cleaning up that liver. And I know, Dr. Bob, we talk about it a lot. Dr. Bob's famous ABCs if you wanted to dive a little bit into what people can do to help with their overall liver function.
Well, you know, it's kind of interesting because we have digital films in our office, wherever you're at in the world right now. If you have an enlarged liver, we'll find it. And we encourage you to eat at least a half a red apple every day. See, apples thin bile, and that's really important because your liver makes bile. We use beet fiber, and the beet fiber also helps the liver decongest in a medium carrot because the liver is the storehouse for vitamins A, D, E, and K. And as a side note, ladies, if you have little floaters in front of your eyes, those are a body signal that you probably don't have enough A, and your liver is really looking for some support. So if you've had 2 children, if you have tender breasts and heavy menses, we need to work on your liver. You know, some of the products, Dr. Kaysen, do you want to talk about a few of the products that we use or which you might want to consider doing out there on your own?
As far as for liver function, we utilize a product in our practice called Livatrid, but also we have something that we recommend for members that don't have a gallbladder because they're not producing those bile salts. We have something called Beta Plus and also Beta TCP. And these are all products to help support the liver and the gallbladder. And another thing that commonly that is very beneficial, especially for women or men, is the castor oil pack. And we encourage our members to utilize this. The bottom right quadrant on top of the liver with a heating pad, and they could do this 2 or 3 or 4 consecutive nights or days in a row to help stimulate overall liver function. And I know that we've even had members, and I know you had discussed this before, Dr. Bob, that had cherry hemangiomas all over their body, and they started healing, and they all went away with working with balancing their hormones and working on the liver naturally.
I think something else that's really important is if you cry easy. Individuals who cry easy, they usually need B vitamins, and your liver needs B vitamins to process the estrogen. That's one of the reasons we also don't promote canned food. You want to be aware of how much soy. We don't promote soy because those all lead to some distress when it comes to your liver function. So we have a couple questions. So before we get into the questions that people have asked, you must say here to receive our giveaway. So all of you watching us tonight, will receive a PDF of Dr. Bob's Drugless Guide to Balancing Female Hormones, which happens to be #1 on Amazon in the whole world for female hormones. So this is a tremendous complimentary gift that we're passing on to you. So you must say here. We have a question from Liam. Is raw beet juice powder as effective as fresh beet juice? Well, I want you to know that we don't even promote beet juice. You don't really ever hear us talk about juicing per se. We want you to eat the food. We want you to eat the food because that fiber is going to help clean your colon out. And we had a question a little bit earlier today. It says, I just found out I have a non-toxic multi-nodular goiters. And they continue on. I started treating them by making dietary changes, gluten-free, dairy-free, and no soy. And you're taking an herbal product for the thyroid. So what we have found is you want to have some testing done, like a TSH, a T3, a T4, TPO, and we're adding a new one, which is the anti-thyroid globulin factor, just to find out if you do have any kind of autoimmune problem. We also know that most people have a deficiency of iodine. And there's something called the urine iodine loading test that we can do that does help make a difference to find out how much iodine your body has or it does not have. So great question. If you have any more questions, we need to have all your questions by 9:20. So Dr. Kaysen, what other questions would you like to address right now or its significance?
One of the questions that we had was, how can I balance my estrogen levels? And I know that there is a specific test if you want to know what your estrogen levels are, and that is done through a urine test. And it's really beneficial, especially for all women, if you're really interested to see what your different urine iodine levels are, or urine iodine, but also estrogen, just find out what those levels are. But I can tell you to work on decreasing estrogen. You want to make sure that you're staying away from foods that would cause an increased estrogen, which would be soy, canned foods, sugar. You want to work on losing weight. If you have excess weight around your waist, excess weight will increase estrogen production in your body. Also, really working on focusing on balancing your liver, which helps to process the estrogen in your body, is very important. And I think commonly I'm seeing women, even, we've seen someone that's 12 and 13 years old that has an enlarged liver on their films from eating too much fruit.
I think that Dr. Kaysen just said something was so huge. We're having at least one new practice member per week come into our office, and their whole abdomen is filled with liver. And they've been to some of the world famous clinics, and they're missing it. And we have conversation, and these people are eating a lot of fruit. And we're beginning now that we're not even promoting fruit anymore because the toxic nature of the fruit. If you decide you want to eat fruit, it better be organic. But basically, you want to eat only a half a red apple every day. I've read several books. One of the books is called Adrenal Fatigue. And if you eat too much fruit, it can compromise adrenal function and liver function. So that you want to avoid some of these estrogen foods that Dr. Kaysen talked about. You want to eat organic, and you want to eat organic meat products if you're going to be doing meat, and you want to do organic dairy. Everything should be organic because there are so many compounds and chemicals. Now I'm going to take a short break, and I'm just going to mention to you that we're going to give somebody as a special gift tonight products that come from Coconut Mission. Dr. C, you want to talk about what your experience with the Coconut Mission and the products that we're going to be given tonight?
So my favorite products are Coconut Mission. So especially the shampoo, the conditioner, I use the toothpaste, the lip balm, and why it's so important and why I love these ingredients, because they do not have any paraffins, they don't have any gluten, any kind of alcohols, sodium lauryl sulfate, all these items that you want to be looking at, especially women. You want to be looking at your cosmetics and what you're putting on in your body, because they're putting all of these fillers and chemicals in your products which cause increased estrogen in your body. So I can tell you that these are some of my favorite products that we're going to be giving away tonight.
It's really fascinating. So someone's going to be winning that. You must put down that you're here to win that. And then before it's all over, I want you to email customercare@druglessdoctor.com, and you're going to receive a free PDF of the book. In the subject line, I want you to write the word free book. So I'm going to repeat that. You must go to customercare@druglessdoctor.com, and you're going to receive a free, this is huge, PDF of Dr. Bob's Drugless Guide to Balancing Female Hormones. You must write in the line free book. And we decided to do something very special because of all of you joining us this evening. If you type in the code Optimal U Coconut when you make your order, Optimal U Coconut, you're going to receive 25% off. That's a lot of off. We're going to be doing that until this Sunday coming up, which I believe might be like November the 2nd. Now, we have our outreach for the month, which happens to be Cornerstone.
Yes, so the outreach for October is Cornerstone Among Women, and the mission of Cornerstone Among Women is to share the love of Christ in word and deed with anyone experiencing an unplanned pregnancy, post-abortion syndrome, or lifestyle distress by providing accurate information. And some of the services that the Cornerstone provide are pregnancy screening and verification, but also decision-making, basics for pregnancy and parenting and adoption. And they help with things as far as babies' needs, but also help with the parenting, education, and support.
So they are really busy over there. So part of our outreach is to help support them. So let's get down to some more important information, ladies, when it comes to estrogen. Now, if you have tender breasts and heavy menstrual flow, that tells us that we know that you have too much estrogen in your body. Our average female patient is between 39 and 43 years old, and they usually come to see us. They've already had 2 babies, like Dr. Kaysen talked about, and they have heavy menses. And they're either going to have a hysterectomy or ablation. And that really frightens us, because ablation is when they cauterize the inside of the uterus. And so our goal with these individuals is to help them make appropriate and necessary lifestyle changes. So Dr. Kaysen, what would you like to add on some of those areas? Because I know that you really work with a lot of the females in our practice.
I do, and as a chiropractor, we work with the brain and the nervous system, which is your electricity. So if you think about it, if you have any kind of subluxation or misalignment in your spine that's compressing those nerves that go to your uterus, your ovaries, or your thyroid, you may not be at 100% function. So especially number one, working with the nervous system is crucial in making sure that you have proper hormonal health. And also what I'm finding is a previous history of birth control, and this is an epidemic right now, of whether it was tender breast or heavy flow, why a woman got put on the birth control pill. But that can have detrimental effects in the future as far as increasing estrogen. And also, I know, Dr. Bob, drugs and medications, all of these things also can compromise overall function. So we look at the overall body, the overall picture. I think it's a stepping process, going slow. Everyone's a little bit different as far as their healing process. But the good news is you can always work on improving function.
You know, we just had another question. So what do you recommend for women who are on birth control? And which is the preset amount of regulated estrogen? Well, when it comes to someone that's on birth control, that's really a very interesting subject, because we have found historically they tend to have maybe some altered cells in their cervix. If someone is on any kind of female birth control itself, oftentimes they may have a vitamin B6 deficiency, and oftentimes they may have some issues with compromised liver function. Now, we're not here to tell you to get off of your birth control. I know we have many people that are using natural birth control methods with success. I know that the birth control itself it really just throws off your hormone. Another question is, what helps with chronic urinary tract health? And what we have found in our experience, and we see a lot of ladies that have chronic urinary infections, is they might not have enough digestive enzymes in their body, and we use a digestive support. We happen to use a product called Hydrozyme. So we have a couple. If you still ask us any questions that you might have, we have about 3 minutes before we won't be able to take any more questions. But I want to throw something out, Dr. Kaysen. We talked at the beginning of the program about thyroid function. We talked about Dr. David Fram. And my recap to you is this. And I'm not saying this to be silly, but all of you watching me right now should have pooped at least 2 times today. I know when I speak up there in public, it always gets people like, he's talking about poop. That's right. You should all have at least 2 bowel movements. Now, it's really as common. Dr. Case and I, and Dr. Anthony, we are all over Northern Ohio. We've been invited to events, and we do screenings, etc. And how many ladies I talk to that don't have regular bowel movements? And we encourage eating kale. You know, the Dr. Case and Dr. Anthony are excellent at creating kale chips. So if you're watching us right now and you're not having a regular bowel movement, you want to have your thyroid gland checked. You want to increase your water. You want to make sure you're using magnesium, because that helps your bowels to move properly.
And you want to increase your exercise, because if you're not moving, you're not working on detoxifying. And I think sometimes they might be doing everything else, but if you're not drinking enough water, not exercising, and doing the more simple things, that could also compromise overall colon function as well.
You know, Dr. Kaysen, because you're a female, I know you're very aware and sensitive to what you put in and on your body. We mentioned the coconut mission. I think we need to share with everybody how important it is as a female. And I know that you really watch what you're putting in and on your body. I know that you and Dr. Anthony really watch. You know, we all as a family watch what we eat. But how about let's discuss that a little bit?
As far as products, it's incredible if you were to go to the grocery store right now and you were to look in the aisle, even things that say organic, and you flip it over and you look at how many ingredients there are. It's really incredible when you really dig deeper to find what's going on. But if you think about it, anything that you put into your mouth, so toothpaste, if you're using mouthwash and fluoride and teeth whiteners, and all these things are chemicals that are getting absorbed right into the bloodstream. And then you look at different cosmetics and lotions and conditioner and hairspray and hair gel, deodorant, which is a huge one, which has aluminum in it, which can cause you to have an increased rate of breast cancer. All of these things that women are putting on their body every day that they might not realize are known carcinogens and we're putting them on our bodies. So as far as all of you women out there, I want to encourage you, you can send us an email. I know Coconut Mission is a great brand. I know that there are some other deodorants out there as far as crystal deodorants and things like that that women use, but also a little bit deeper as far as feminine products too. I don't know if women knew out there, but they put pesticides on cotton, which you might be using as your feminine products, which you're putting inside you. So you want to look at everything that you're putting in and on your body, and also your kids, your families. You want to see what kind of cleaning products you're using. All of these things can cause increased estrogen in your body.
And the factor is that your liver has to process this. And if you're putting, the average female puts between 125 and 150 chemicals on her body every day. So if you're doing that, this is very serious. So if your breasts are tender or you have heavy menses, it's a body signal of liver. If you cry easy, your body needs B vitamins. I'm going to throw out a word to you right now. It's called apoptosis. Apoptosis is limited cell life. And what we have learned from our own experience, and that's why Dr. Kaysen mentioned earlier about the urine iodine. I don't know if you ever knew, but we can literally test how much iodine you have in your body. Well, iodine is important to limit cell growth for cancer cells, and so is vitamin D as in delta. And I know that we test our practice members for iodine and vitamin D, Dr. Kaysen.
And also you want to see other things that are going on as far as inside your body. So we're checking thyroid function, we're checking previous history of medication, surgeries, not having your gallbladder. That's a really big thing, and we're seeing an epidemic of that. If you don't have your gallbladder, a lot of times you could have your gallbladder removed because the liver wasn't functioning at 100%. And it's not the gallbladder, it was the liver. And I know that we're seeing that as an epidemic. Do you have another question, Dr. Bob?
We're getting coming all over the place now. It's good. Is it toxic to a nursing baby if I work on my liver while I'm breastfeeding? Is there anything gentle that I can be done in the meantime? I would tell you this, and I know that Dr. Kaysen would agree. You want to primarily put and consume organic fruits, which is the apple, and vegetables in your body, and let your body just process naturally, because we just eat a clean, healthy diet, and your body will do its best to process. I think what's really significant is some B vitamins. What can help with possible scoliosis and back pain? You want to touch on that one, Dr. Kaysen?
Sure. As far as scoliosis, we do very specific live video fluoroscopy, which is motion films in our practice. The best time to get checked is sooner in life. The spine actually is complete growing at age 22 and 23. So as far as scoliosis, if it's after that 22 or 23 years old, we can still work on improving function. But sometimes with scoliosis, that might be someone's normal. But what's really significant and important is that they get specific chiropractic care to help with overall posture, but also the nerves that go to your lungs, your heart, your digestion, your male and female organs are all inside that spinal cord.
You know, it's kind of interesting because we don't usually say this too much in public, but we don't really promote gymnastics. When we have individuals that come into our practice that have scoliosis, and I ask them if they're in gymnastics, more often than not they were. I'm not telling you to stop gymnastics, but I know cheerleading, but especially gymnastics, has a tendency to create distress on the spine. We had another question I want to address. Let me get to it. It's what can I do to help muscle cramps? We have found we use something called BioCMP, which is calcium, magnesium, and potassium. For sure, a calcium supplement would help. And I also know, because we use a product line that has a product called 3GB, which is the fat-soluble version of the B vitamins, that also helps with cramping. I know we have just a short time left. I want to just touch a little bases with you once again. If you would like to, you could go to our website, which is druglessdoctor.com, as you know. If you would like to, between now and Sunday, which is going to be November the 2nd, we're going to give off 25%. You have to use a special code. It's Optimal U Coconut. You'll receive 25% off your order until Sunday. Also, if you'd like to receive a free PDF of Dr. Bob's Drugless Guide to Balancing Female Hormones, I want you to email customercare@druglessdoctor.com. You'll receive a free PDF. You must put in the subject line free book. And if you want to potentially win our Coconut Mission giveaway tonight, you must type in the word here. You only have a few minutes left. I want to give you a true story. It's amazing the stories that we hear about toothpaste and then one person's skin on their face. You want to talk about that, Dr. Kaysen?
Yes, so all women are conscious about their skin, and we had a woman in our practice who was utilizing a name brand toothpaste out there that you could get at any drugstore, and she was actually breaking out, and she had boils and acne around her face and on her mouth, and she did the simple switch. She started using the Coconut Mission toothpaste, and I believe it was a week after she started utilizing the toothpaste, her skin cleared up. And that's how significant it is that we look at what we're putting in and on our body, because that goes right into our body, and her body was breaking out, trying to get rid of those toxins and chemicals.
Probably the winner of the Coconut Mission is Sharon Castillo. And Sharon, you need to email customercare@druglessdoctor.com. So Sharon Castillo, you are the really great, you're going to win the Coconut Mission products tonight. Congratulations. I know that you're going to enjoy the conditioner and shampoo that we're going to be sending out, and thank you for participating with that. Now, what kind of foods should you eat to help manage your estrogen levels? Well, first you want to do, of course, Dr. Bob's ABCs. That helps liver function. But probably the most significant food that anybody could consume is broccoli. That would be sauteed broccoli, raw broccoli, stir-fried broccoli. I know I eat broccoli in my salads. Broccoli will help manage your estrogen. And Dr. Kaysen talked about certain foods earlier as far as what you can and you can't do. And I know you want to avoid soy, and I know that broccoli is very good. Any kind of cruciferous vegetable is good. One other question, is there a permanent cure of hypothyroidism, or will I be taking Armor for life? Well, in our practice, and I actually listened to a CD today for an hour. That's how long we could answer this for. Yes, we can help support thyroid function, but we mentioned something earlier with bromine, fluorine, and chlorine. You want to minimize that. And you want to have a TSH, a T3, and a T4 done, because that helps determine what's going on. But we briefly touched that. I just have to throw this in before it's over, because we have so much we could talk to you about. It's the urine estrogen. Doctor, we don't usually talk about this too much, but we can actually tell you if you have too much estrogen in your body with the urine test. So, I mean, for just a little bit of investment of your time and your finance, we can tell you how much estrogen you have in your body, how much iodine you may or might not need, and vitamin D. So, you know, we're here to make a big difference. Dr. Kaysen, we have a minute or two left. Is anything, since, you know, you see so many of the females in our practice, that you'd like to share with everybody to impact them?
I think working on balancing your female hormones now, and a lot of times women think that they're too young or too old to work on balancing their female hormones, but it's never too soon or too late. And especially being a woman, I've seen so many unnecessary surgeries and medications and other things going on when we can work on balancing our bodies naturally from the inside out versus the outside in. So I want to congratulate everyone on being here tonight to be able to be empowered to ask maybe different questions or look more deeper into their overall health and healing.
You know, and every week I create a video called Ask Dr. Bob, and we have a lot of wonderful questions. You can just go to our website, track it down, type in the questions. We do our very best to answer as many of them that we possibly can. I know the thyroid is really an important part of what our learning experience is. Make sure we have just a short time left that you type in that you want the free book. You want to make sure that you go to customercare@druglessdoctor.com and read the information. You know, it's a matter of life and death. If you have hot flashes, we help hot flashes with iodine, and we help them with oil. If you want to get pregnant and you can't, we found that subpar thyroid function, once that improved, will help also. Start eating your apple, beets, and carrots every day. And remember, until November the 2nd, you can use the code OptimalUCoconut to save 25%. We appreciate you following us. You know, join us on Facebook, like us, pass this information on. Our goal is to empower people with information. You know, we have a combined practice experience of well over 40 years. We have the most innovative technology on the planet. So come and visit us in Westlake, Ohio. And thank you for joining us this evening. You know, enjoy the rest of your night. Thank you so much. Bye.